In this video, we'll be learning about PCPNDT Act enacted in 1994, and also we learn about its amendments. This video mainly focuses on what a resident must know. This is a must know topic and also a viva question and a long essay for the radiology residents. So this helps you to answer the viva questions and also answer the long essays. Also helps you to go about in day-to-day practice, and I have simplified the points from the main legislature in this video. Initially, it was known as the PNDT Act. We'll see how it came about. In 1988, state of Maharashtra became the first in the country to ban the prenatal sex determination through the enactment of Maharashtra Regulation of Prenatal Diagnostic Test Act. So it was initially a state act. Next, it was nationalized by the parliament. So the parliament assented to the Prenatal Diagnostic Test Act on 20th September 1994. This was to provide the regulation of use of prenatal diagnostic techniques, and the act commenced on 1st January 1996. So these two dates you have to remember. It was put on paper and the bill was passed on 20th September 1994, but the act came into practice in 1st Jan 1996. And according to the PNDT law, it is prohibitory and regulatory stature in order to check female feticide. That was the initial motto, and even now that is the motto of the PNDT Act. Because of the increased number of female feticide, this act has to be brought about, and initially Maharashtra took the initiative to get this act in practice, and later it was nationalized by the parliament. So I'll read out the lines of the PNDT Act verbatim, and this is the PCPNDT Act. This is the recent version, that is PCPNDT. I'll explain what is the difference between PNDT and PCPNDT later in this video. So PCPNDT states that an act to provide the prohibition of sex selection before or after conception and for regulation of prenatal diagnostic techniques for the purpose of detecting genetic abnormalities or metabolic disorder or chromosomal abnormalities or certain congenital malformations or sex-linked disorders, and for the prevention of their misuse for sex determination leading to female feticide and for matters connected therewith or incidental thereto. So this states that whatever prenatal diagnostic techniques are supposed to be used, they were not regulated initially. So this law brings those techniques into their regulation, into the visualization of the law, so that they cannot be misused for sex determination. The prenatal diagnostic techniques are to be utilized for these things mentioned here, that is the detection of genetic abnormalities, metabolic disorders, chromosomal abnormalities, and congenital malformation, sex-linked disorders. But it should not be used for sex determination and thereby leading to the female feticide. Objectives of this act was to prohibition of misuse of PNDT, prenatal diagnostic techniques for sex determination, prohibition of advertisement of the same, permission and regulation of use of PNDT by registered centers under specific circumstances. Like normally when we use ultrasound, it is used for the detection of genetic abnormalities, and this act states that all of the ultrasound machines or any diagnostic tests like genetic tests, whichever laboratory or the institute performs, should be under the permission and regulation of this act. This also states punishment for violation of the provisions of the act. So I told you that initially it was PNDT and later amendments were done. So the first amendment was done in 2001 and the second amendment was done in 2002. So the nomenclature of the act, that is from PNDT to PCPNDT, That was done in 2003 and it stands even till now. So initially it was just prenatal diagnostic test. Now it is preconception and prenatal diagnostic techniques. So Prohibition of Sex Selection Act 1994. We all know that prenatal means before the birth of the child. So whatever we do ultrasound and everything, that is prenatal. So before the birth we can determine sex of the child and we should not determine the sex of the child. But what does this word preconception mean? Before conceiving itself, can we determine the sex of the child? So this act brings about the term preconception into its name. With the advent of new technologies like IVF and ICSI, pre-implantation genetic diagnosis and sperm sorting and sperm separation, it is said that we can determine or make sure that the baby will be of a particular sex. So those practices came into action and that's why preconception tests were also brought into the legislature. Sex selection in any practice that increases likelihood of conception, gestation and the birth of a child of one sex rather than the other. Those are called as the preconception tests. That is the misuse of preconception test. So as per the act, it includes any procedure, technique, test or administration of prescription or provision of anything for the purpose of increasing probability that an embryo will be of particular sex. So these tests are also brought into the legislation and under the supervision of PCPNDT Act. What are the implication of 2002 amendments? So that was a final amendment and in 2003 only the name was changed, amendments were not done. So it mainly covered bringing in the technique of preconception sex selection under the ambit of the act. Also bringing the ultrasound within its ambit. Initially just diagnostic tests like genetic tests were brought first, then the 2002 amendment brought the ultrasound within its ambit. Empowering the Central Supervisory Board, constitution of state level supervisory board under its act. It also brought provision for more stringent punishments. Empowering appropriate authorities for search, seizure and sealing of the machine of the violators of this act. So whichever ultrasound center, institute or hospital violates this act, appropriate authorities are empowered to search the institutes and seizure of the ultrasound machine and sealing of the machines. It also regulates the sale of ultrasound machines only to the registered bodies, and even the forms which you have to fill, I think all the residents know what is form F, form G, etc. So all the forms which were under this act were simplified in the 2002 amendment. The act first gives the definitions of what are the terminologies which we have to know in order to understand the PCPNDT Act and what all comes under the legislature of PCPNDT Act. So the first definition is conceptus. Conceptus is any product of conception from fertilization till birth, including the extra embryonic membranes and embryo as well as the fetus. So anything from the time of conception, that is the time of fertilization till birth, is called conceptus. It includes the amnion, chorion, the placenta, cord, everything. Next is the embryo. Embryo is nothing but the conceptus till the 8th week. From the day of fertilization till the 8th week, that is the first 56 days, the baby is called embryo. And next, fetus. Fetus is from the 57th day after fertilization till birth. So you have to use appropriate terminologies. What is embryo, what is fetus, and there are definitions for the places also. So what is a genetic counseling center? Any hospital, institute or place which provides genetic counseling to patients, as the name suggests, is the genetic counseling center. Genetic clinic is again any hospital, institute or a place conducting the prenatal diagnostic procedures is the genetic clinic. Genetic laboratory, any hospital, institute or place conducting analysis or tests of the sample. So procedures are conducted in the clinic and the analysis of the test samples are done in the laboratory. So these two are the definitions of places. Next, what all comes under prenatal diagnostic techniques? So there are two things, including prenatal diagnostic procedures and prenatal diagnostic tests. So these two are different. Both come under the larger term of prenatal diagnostic techniques. That's why the word prenatal diagnostic technique is used and not tests, because test is just a part of it. Procedures are also included in the techniques. What are all the prenatal diagnostic procedures which we know? So all gynecological, obstetric, medical procedures such as ultrasound, fetoscopy, removing samples from the amniotic fluid and chorionic villi, or taking of blood or any other tissue fluid is known as prenatal diagnostic procedures. So these are the procedures where we either do ultrasound, do fetoscopy or take samples. So that is the procedure, and anything done before the birth, that is prenatal or even preconception, are come under the prenatal diagnostic procedures. Next is the diagnostic tests. So what are the tests? So ultrasound is again a procedure and also a test, or any test for analysis of amniotic fluid, chorionic villi, blood, any tissue or fluid of the pregnant woman or conceptus is a prenatal diagnostic test. So now I know that both of them look similar to you, but I'll explain the difference. So now we do a procedure called amniocentesis. That is a procedure. Amniocentesis is nothing but we take amniotic fluid from the fetal amniotic sac, and that is a procedure, and from which we get some amniotic fluid which we send for the lab for test, and that test is called prenatal diagnostic test. So that is the difference between procedure and a test. Simple English. So these procedures, nothing but they give some samples and those are tested in the genetic laboratory. So procedures are different from tests and both of them are included in the techniques. What are the common indications where these techniques are done? So indications of prenatal diagnostic techniques are to detect chromosomal anomalies, genetic metabolic diseases, hemoglobinopathies, sex-linked genetic disease, congenital anomalies, or any other abnormalities or diseases that may be specified by the Central Supervisory Board. So this list is actually a long list which is given in the legislature, but I have taken the most common points where all the prenatal diagnostic techniques are used. When can the prenatal diagnostic tests be conducted? This is under the legislature, given that when all it is justified to conduct these tests. So these tests can be conducted only for the following indication and should not be conducted for sex determination. So it can be conducted when the pregnant woman is above 35 years to rule out genetic disorders like Down syndrome, when a pregnant woman has undergone 2 or more spontaneous abortions or fetal loss, in order to know what is the chromosomal anomaly repeated. Pregnant woman has been exposed to potentially teratogenic agents such as drugs, radiation, infection or chemicals in the first trimester mainly. And it can be done when pregnant woman or her spouse has a family history of mental retardation, physical deformity such as spasticity or any other genetic disease, in any other condition specified by Central Supervisory Board again. And the reasons for conducting the prenatal diagnostic test should be given and recorded in writing. That is very important. Is there any test where informed consent is not required? Let's see. After the amendments to the Act, there has been a bifurcation of procedures adopted for invasive and non-invasive tests. So, invasive tests are those which have risk of causing miscarriages. For example, amniocentesis, chorionic villus sampling, fetal blood sampling. They all have interventions. So, you intervene That is, you put a needle within the patient, and those are ones which are having more risk of causing miscarriages. So for these invasive tests, we require consent. We're talking here about written consent, not the informed consent. And next, non-invasive tests. Non-invasive tests such as ultrasound do not carry such a risk, and hence consent of pregnant women need not be taken. You've all seen whenever the pregnant woman comes for the test, we don't make her sign a consent form. We'll just make her sign the form F, where we declare that we have not done sex determination. So we don't ask for a separate consent. But in case of any biopsy or any other normal procedures I'm talking about, we always take a consent. So these invasive tests in pregnancy also, we have to take a separate consent other than the form G which we fill. However, before taking the test, the woman has to give declaration stating that she does not want to know sex of the fetus. This is what is mentioned in the form F. Similarly, the medical professional conducting the test also has to declare that he or she will neither detect nor disclose the sex of the fetus to any person. Who are the qualified person under the PCPNDT Act? A gynecologist is qualified to do counseling, ultrasound, prenatal procedures. A medical genetist can do only counseling. Pediatrician can do only counseling. Registered medical practitioner, that is the one who has 6 months training in ultrasound post MBBS. He can also perform ultrasound only. Next, laboratory technician is only qualified to do laboratory work, not to do counseling, not to do ultrasound. A radiologist can do ultrasound and prenatal procedure. A sonologist, any person who possesses MBBS degree and postgraduate qualification in either radiology, that is MD, DNB, DMRD, DMRE, or in ultrasound for 6 months. So even you postgraduates, after 6 months of residency, you are qualified under PCPNDT Act to dispatch reports on your own and signing on the form F. What are the forms under PCPNDT Act? So there are many forms. We'll discuss the main ones. Form A is for registration of imaging center or renewal of registration. Form B is nothing but for the certificate of registration, and this has to be displayed at the clinic. Form C is for rejection of registration of imaging center. In case it's rejected, we have to fill the form C. Next, form D is for the maintenance of records by the genetic counseling center. Form E, form for maintenance of record by the genetic laboratory. Form F, all of you know, it's very important. It's for maintenance of record by genetic clinic or the imaging center. Okay, so for counseling center, it's form D. For laboratory, it is form E. And for genetic clinic and imaging center or any hospital or any nursing home, wherever the ultrasound is there, wherever the procedures techniques are done, we have to maintain form F. Form G is the consent form for prenatal invasive diagnostic tests. Form H is form for permanent maintenance of application for grant or rejection of registration. Did you know, this is an important or an interesting fact, that Ayurvedic therapies have been developed for sex pre-selection on the basis of notion that sex of the fetus is determined 6 weeks after fertilization. So this is contrary to the established fact that sex of the fetus is fixed at the time of fertilization. But they counsel that some Ayurvedic practitioners counsel that till 6 weeks of after fertilization, sex is not determined. So till 6 weeks you take this medication and the baby might be born male or might be born female. So these are the hoax which are spreading. And several preparations are available in the market claiming to be effective in selecting the desired sex. But little do they know that at the time of fertilization itself, sex is already determined and you cannot modify this using any Ayurvedic medication. However, the basic requirement is that a person should be registered medical practitioner. So PCPNDT says that in order to do any ultrasound or genetic counseling or anything, he should be a registered medical practitioner. And since only allopathic medical professional can register with Medical Council of India, a person with non-allopathic qualification cannot perform sonography. So Ayurvedic people, whatever they can claim that they can give medications, but they cannot perform sonography because they are not registered under MCI. So 2002 amendment got the ultrasound within the PCPNDT ambit, and the legislature states 23 indications which are prescribed by the ICMR. These are included in the PNDT rules for which ultrasound scanning can be done. This includes the well-being of fetus and the pregnant woman. So whatever we do ultrasound day-to-day basis on a pregnant woman, there are 23 indications given by the ICMR, and only for these indications scanning can be done on a pregnant woman. You can take a screenshot of this, go through this, and it's also mentioned in one of the article. I have taken this from an article itself about these 23 indications. If you can remember, well and good. Now coming to the government institutes which are given power to implement the PNDT Act. So what all the institutes come under the PNDT Act? This is for following or the putting the legislature into practice. So there are two types of activities under the PNDT Act. First is the policy making, next is the policy implementing. So for making the policies, we have Central Supervisory Board and a State Supervisory Board, and for implementing the policies we have appropriate authority and a advisory committee. Let's see the power of each of these government institutions. So Central Supervisory Board and State Supervisory Board, these do the policy making mainly. So the Central Supervisory Board is headed by Ministry of Department of Family Welfare, and the head of the Department of Ministry of Family of Welfare is the chairman of the Central Supervisory Board. The board has to meet every 6 months. It advises the government to make policies, and it also monitors whether the government implements the policies. It also creates awareness among the public. So what do? Every 6 months they meet, they make policies, they give it to the state, they ask the state to make their own policies, they make sure it's followed also, and they create awareness of PCPNDT among the public. Next, what is the function of State Supervisory Board? Similar, it creates awareness in public, it monitors appropriate authorities, and also sends regular report to the Central Supervisory Board. Coming to appropriate authority, it has the majority of the functions. So the head of this one is appropriate authority is appointed at state, district and sub-district levels. At district and sub-district level, the chief medical officer or civil surgeon will be the head. So appropriate authority can grant, suspend or cancel registration. It can conduct regular inspection of all ultrasound centers registered once in every 90 days. It investigates complaints which are given under PCPNDT Act. It takes complaints to the court. It can issue search warrant to any imaging center which is suspected of performing sex selection. Simple. Almost all the work what has to be done under PNDT Act is done by the appropriate authority. Then there is an advisory committee. It advises the appropriate authority. They also meet every 60 days, and appropriate authority has to attend the meeting held by the advisory committee. Let's again focus on the power of appropriate authority. The Act gives suo motu. That is, you need not have a formal complaint. It has a suo motu power for to search, to seize, and to the accessibility. It can access the records for inspection to any person authorized by appropriate authority. So any person who is authorized by appropriate authority can go search, seize, and he has accessibility to all the records of any imaging center. They have a power of summoning any person who is in possession of any information related to violation of provisions of the Act. They can ask for production of any document, material or object relating to the above clause. They can issue search warrant to any place suspected to be indulging in sex determination techniques. What are the mandatory prerequisites for an ultrasound clinic under the PNDT Act? Main thing is the registration of clinic is mandatory. Details of all machine, all radiologists with a copy of their registration certificate to be submitted. In case of portable machines, if ultrasound is to be done in a vehicle, then registration of vehicle to be required. For example, if ultrasound is kept in an ambulance while going for a rural service or during emergency e-fast scan conducted in the ambulances, even though only non-pregnancy scans are conducted, still you have to register, because pregnancy scans can be conducted on a ultrasound machine. If it is kept in a vehicle, you have to register the vehicle under the PNDT Act. A copy of this registration, the registration given by the appropriate authority to our clinic, that copy should be displayed in the machine room and also in the waiting room. Signboard should be kept in English and all the local languages displayed, indicating that fetal sex is not disclosed in the clinic. And the unit as a whole, including the place, equipment or machine and the doctor, has to be registered with the appropriate authority. So if I am doing ultrasound in a hospital, the hospital should be registered, the ultrasound room should be registered, machine should be registered. If I am performing the investigation, even I should be registered under the PNDT Act. What to be displayed in the ultrasound room and clinic? Let's revise. Certificate of registration of the place, copy of the PNDT Act, that small book of that actual legislation which is available should be kept. A copy of PNDT Act book should be kept in the clinic always. Names of the doctors should be displayed with a qualification, and a notice displaying conduct of sex determination or disclosure is prohibited under law and not done in the center should be written in both English and local languages. So this was our PNDT display board given by the Delhi government. This is from my college, my alumnus, that is MAMC. So this was displayed in all the corridors and inside the ultrasound room, waiting room, wherever the ultrasound machine was kept. Coming to the documentation. Form F must be filled completely as soon as the ultrasound of that patient is done. Very important. Signed consent of the patient and radiologist signature are the must. That sex determination is not done, not declared. After all the F forms are being filled, every month a monthly report should be submitted to appropriate authority within the 5th of next month. So if I am filling for this April, next within May 5th, the April record should go to the appropriate authority. All records including Form F and reference doctor requisition, case record, ultrasound reports must be kept for 2 years. So request form from the obstetrician, our Form F, which is having both signature of patient and mine, the ultrasound report with images or films if they are given should be preserved for 2 years, and if images are provided to the patient, then we have to keep a copy of it. In case of any legal dispute, that in case any legal dispute happens with a patient, then you have to keep the records of that patient till the legal proceeding of that patient is over. You cannot keep it only for 2 years and then dispatch it. Minimum 2 years for all the patient, but in case some case happens, you have to keep it till the end of the legal proceeding. PNDT Act book must be available in the department. So all these come under the documentation. How is the procedure of registration? In case you want to buy an ultrasound machine for your hospital, for your clinic, what to be registered? You have to register the center, you have to register the machine, the sonologist, and also the place. Place means the hospital or the clinic or even a vehicle. If you're doing it in a vehicle, you have to register all of these. For that, you have to submit Form A, first an original and also a duplicate copy of Form A to be submitted. There is an application fee for this, 25,000 for a genetic counseling center, clinic or laboratory, or ultrasound center, imaging center. For all this, 25,000 you have to pay for registration. And if it is a single thing, like if I own only an ultrasound center, then I have to pay 25,000. Only a clinic, then 25,000. Only a laboratory, 25,000. But if I own a counseling center along with a clinic, so if there's any combination of two things of these, you have to pay 35,000, and DD has to be done, and it should be made in favor of appropriate authority. So after the filling the form, you have to get an affidavit, which is an undertaking that center shall not be conducting any procedure for sex determination, and it should display this affidavit in a prominent signboard. Particulars of the ultrasound machine, qualification of the doctors, everything should be attached to this affidavit. And grant of certificate or rejection will be done by appropriate authority within 90 days. So within 90 days of submission of Form A, you will get either a approval or a dismissal. And certificate of this approval registration is non-transferable. You can't register your ultrasound machine, certain machine in your clinic, and once you shift the machine to a different clinic, you can't transfer that certificate there. They have to register it again under their place, their name, and that machine has to be re-registered. And for re-registration also, it's Form A. And that's what we're coming to that. Change of ownership or management, 2 copies of registration certificate, the previous ones to be surrendered to the appropriate authority, and new owner should apply a fresh application. And validity for each registration is 5 years, and after that everything should be re-registered. So that is renewal of registration. So for that also, Form A has to be given, and it has to be given in duplicate also. That it has to be given 30 days before the date of expiry. Like now 5 years is about to complete. Within 30 days of completion date, you have to give an application. 2 copies of earlier certificate to be given. And for new registration, it is half of the original fee. So if it was 25,000, it's 12.5. And further renewal of after 5 years should be done. And intimate any change within 30 days. Like if you're submitting the renewal, and if you don't want a renewal, you have to give in writing again within that 30 days. Send a complete report of all pre-conception and pregnancy related techniques at least within 5th of every month. That has to be done always. Coming to what are the criminal offenses coming under PNDT Act. So whatever violates the PNDT Act, so whenever sex determination is done, it comes under the PNDT Act, and the offenses are cognizable, non-bailable and non-compoundable. That means you need not have a formal written complaint. That is, you need not have somebody coming in complaining or filing an FIR. If police get a suspicion, they can come and arrest, and it does not require even a warrant for it. So complaint not required, warrant not required, and it's non-bailable offense. So if you're arrested under the PNDT Act, under the violation of PNDT Act, the bail cannot be given. And trial is done by the Metropolitan Magistrate or the Judicial Magistrate of the first class. Coming to the violations and the penalties. So these are the violations coming under minor offenses. So we'll discuss the minor offenses because these are easy to occur, and you have to keep in mind that these should not be happening in your department or the clinic from wherever you are working in. So first violation is non-availability of copy of the PNDT Act book. So if that small book which has to be mandatorily kept not available, then it's a violation. Non-display of the registration certificate, and non-display of the board in the premises, PNDT board, that sex determination not done here. So if that is all the display things are not available, it's minor offense. Punishment is up to 3 months or a fine of up to 1,000 rupees for first offense, and additional fine up to 500 per day till you recorrect the offenses. And show cause notice can be given for temporary suspension of registration also. So if minor offenses are done, then even show cause notice. Show cause notice is nothing like, it's like a warning notice can be given. And Now we have other minor offenses. So unregistered centers, equipment can be sealed and seized by appropriate authority. Any irregularities in registered center, like any unqualified ultrasonologist or any minor deficiency in record keeping, if they get to know, it may issue the show cause notice. It may cancel the registration or suspend the registration without issuing the show cause notice. So this can be done. So unqualified ultrasonologist is also a minor offense, and a minor deficiency in record keeping, that if you have not kept a form F or filled it properly completely, it comes under a minor offense. Coming to the major offenses. Major offenses is what the legislature states that sex determination should not be done. So if sex determination is done, then it's a major offense. So sex selection, determination and communication of the same, if it is known to be done, then there is temporary suspension of registration of the doctor under the MCI. So his MCI registration number is temporarily suspended, and for first offense he can be put in jail for 3 years, fined up to 10,000 rupees, and removal of his name from MCI register for 5 years can be done. And if he comes out and repeats the offense, so for second offense, 5 years of jail, 50,000 of fine, permanent removal of his name from MCI register. So this is a very big thing. And if they do any advertisement regarding sex selection, that if they advertise telling that okay, we determine sex here, or if any thing reaches the police or appropriate authority, they can come and arrest the doctor or the clinician, who can be imprisoned for 3 years and fine up to 10,000 can be given. Coming to what is a show cause notice, I already told you, it's like a warning notice. It is issued in cases of inappropriate maintenance of ANC registers. So all details must be mentioned, including address, contact numbers, last menstrual period of the pregnant patient, and the form F must be properly filled. Every new version of form F should be used in duplicate form, kept in the duplicate form. Now again, form S is not in a written form. It is in online form in a website called Balika. Balika website is the one which we use to fill form F. And then not only the online filling, then after filling it digitally, we take a duplicate of it, get a sign from the patient, get a sign from the treating doctor or the doctor who is performing the ultrasound. That copy should be kept for 2 years. All the columns have to be filled. All forms must exhibit name and designation of the doctor performing the test. Reference slips of the obstetrician and a copy of Aadhaar card of the patient has to be attached with the form. PCPNDT certificate must be displayed at all conspicuous places. That means you can't hide it behind the curtains or anything. It should be seen very much visibly. If these are not there, then show cause notice can be issued. So simplified version or the summary of what all you have to do, what all you shouldn't do. So what all you have to do, you have to register the clinic. Detail of all machine, all radiologists and their copy of certificate should be submitted. In case of portable machine, vehicle has to be registered. In case and copy of registration must be displayed always. Signage board telling sex determination not done in both English, local language should be displayed always. Number of machine and radiologists attached to the clinic has to be mentioned in the registration certificate. Form F must be filled completely. A monthly report should be submitted to appropriate authority before 5th of every next month. All copies should be kept for 2 years. PNDT book have to be available. Appropriate authority must be informed in writing about any changes you're doing with either the machine or the clinic or the place or the registration. If a locum radiologist is appointed, appropriate authority must be informed in advance and be cooperative with the appropriate authority when they visit your clinic. Very useful. Most important point, when they come for inspection, be cooperative. What all documents they ask, please give it. What all you should not do according to PNDT Act. Do not disclose the sex of fetus in any circumstance. Do not start an ultrasound clinic without PCPNDT registration. Do not visit any clinic or hospital for USG unless it is registered, unless you are also registered as a locum practitioner. Then do not go to any centers. Do not give an experience certificate to anybody. Do not get scared by anyone if you are following rules as per PCPNDT law. Very important again. Do not allow anyone to check your records unless accompanied by the appropriate authority, because these are legal documents and should not be messed with. So what does the PCPNDT Act say? Again, summary: sex selection and sex determination are prohibited, and they should not determine. First thing, they should not communicate either to the pregnant woman or her relatives by words, signs, or in any other manner. Register all the machines, register all the doctors, and display the registration, display the signage board in local language English, and do not advertise or do not assist in sex determination. Thank you. This was all about the PCPNDT Act, and this is a very important topic both for your practice and for your exams as well. And if you have any doubts, you can put it in the comment box below, and please subscribe to our channel and follow us both on Instagram and Radiology Doodles on the YouTube channel, whatever we have. I have made into playlist. I have many clinical videos also. If you want any other videos, please comment down below. Thank you.